Hi everyone, it's me, your AI doctor. Today we're meeting in a longer video format so I can share more with you. And without further ado, today we're talking about mental health. So, what exactly is it? Let's find out. Mental health is directly related to how we think, feel, and act. Good mental health means we can handle life's ups and downs. It allows us to enjoy life, have good relationships, and contribute to our community. Just like physical health, mental health is essential for our overall well-being. When we prioritize mental health, we're investing in our ability to live a full and meaningful life. Taking care of our mental health is just as important as taking care of our physical health. It's about nurturing our minds and emotions to live our best lives. Remember, seeking help is a sign of strength, not weakness. By seeking support, we are actively taking steps towards healing and growth. Mental health challenges can affect anyone, regardless of their age, background, or lifestyle. It's important to remember that mental health problems are common and treatable. While mental health issues can affect individuals throughout their lives, some groups may be more vulnerable due to various factors. These factors can include genetics, life experiences, and social determinants of health. For example, people who have experienced trauma, chronic stress, or discrimination may be at a higher risk for mental health conditions. Access to health care, socioeconomic factors, and cultural stigma can also play a role in influencing mental well-being. It's crucial to approach mental health with empathy and understanding. By fostering supportive environments and promoting open conversations about mental health, we can create communities that prioritize well-being for everyone. Mental health problems can show up in many different ways, and it's really important to recognize the signs so we can help early on. These signs might appear slowly or suddenly, and they can affect every part of a person's daily life. It's important to remember that everyone experiences emotions differently, and what might be a sign of a mental health problem for one person might not be for another. Some people might feel sad or worried for a short time, while others might experience these feelings for a much longer time. Common symptoms of mental health problems can include sadness or hopelessness that lasts for weeks, months, or even longer. These feelings can make people lose interest in activities they used to enjoy. Excessive worry or fear can appear for no clear reason and can make it hard to do everyday things. Too much worry can even lead to physical symptoms like a fast heartbeat, sweating, and trouble breathing. Big changes in appetite or sleep, like not sleeping enough or sleeping too much, eating too little or eating too much, can also be signs. These changes can affect a person's energy and ability to focus. Withdrawing from social activities and avoiding friends and family can also happen. This might be because of feeling like they don't want to bother others or feeling like no one understands them. It can be hard to focus or make decisions. People with mental health problems might find it difficult to concentrate on work or school, and they might feel confused or unsure about everyday choices. Also, some people might experience physical symptoms like headaches, which can occur frequently without a clear cause. Stomach aches or tiredness are also common. Tiredness can be the result of not getting enough sleep or feeling drained from constant worry and stress. It's important to remember that these physical symptoms can be related to many different things, and it's essential to talk to a healthcare professional for a proper diagnosis and treatment. They can help figure out the root cause of the symptoms and suggest the right treatment options. If you or someone you know is experiencing any of these symptoms, it's important to seek help. Don't hesitate to talk to friends, family, or a professional about what you're going through. Remember, you're not alone, and seeking support is a sign of strength. Support from those around you can help you get through tough times and find balance in your life. Always remember that mental health is an important part of overall health, and taking care of it is essential. Part 4. Understanding the roots of mental health issues. Mental health issues can arise from a complex mix of factors. These include things like our biology, genes, environment, and social situations. These factors don't work alone. They often overlap and affect each other, creating a complicated picture of cause and effect. It's important to look at mental health from a big picture view. There's no single cause for these conditions. Each person is unique, with their own experiences and circumstances. So, the things that cause mental health issues will also be different. Our genes can play a role in making someone more likely to have mental health conditions. Studies show that some mental disorders can run in families. This means if someone in your family has a condition, other family members might be at risk too. But genes aren't the only thing that decides our mental health. Our environment and personal experiences also play a big role. A healthy and supportive environment can help lower the risk of mental health issues, even if there's a family history. Life experiences like trauma, abuse, neglect, or big life changes can also contribute to mental health issues. These experiences can leave a lasting impact, affecting how a person sees and reacts to the world. Ongoing stress, social isolation, and discrimination can make these challenges even worse. When someone faces constant stress without support, they can feel overwhelmed and unable to cope, leading to mental health problems. It's important to remember that mental health issues aren't a sign of weakness or a personality flaw. Instead, they're a natural part of being human and can be affected by many different things. Understanding and accepting this can help us approach the issue in a more caring and effective way. By understanding the many sides of mental health, we can encourage empathy, reduce stigma, and create supportive environments for those struggling with mental health issues. This not only helps improve the lives of those affected, but also builds a stronger and more united community. We need to remember that everyone can play a part in creating a positive environment where mental health is valued and cared for. Part 5. Finding Help. A Guide to Mental Health Treatments. Getting help for mental health problems is really important for getting better and improving overall health. Luckily, there are many treatment options, from therapy and medicine to lifestyle changes and support groups. Therapy, such as cognitive behavioral therapy or dialectical behavior therapy, can help people identify and change negative thinking patterns and develop healthy coping skills. Medicine, such as antidepressants or anti-anxiety drugs, can help manage symptoms and improve mood. However, it's important to talk to a qualified healthcare professional to figure out the right medicine and dosage for each person. Lifestyle changes like regular exercise, a balanced diet, and getting enough sleep can also play a big role in supporting mental health. Also, support groups can offer a safe and encouraging space for people to connect with others who understand their experiences. Part 6. The Challenge of Self-Diagnosis. Why recognizing mental health conditions can be difficult. Recognizing mental health conditions in ourselves can be tough for several reasons. First, the symptoms are often unclear and easy to miss. We might feel sad, worried, or tired, but think those are just normal, everyday feelings. Often, people downplay or ignore their symptoms, blaming them on stress, tiredness, or other outside factors. We might tell ourselves we just need some rest or a change of scenery, but this can make symptoms worse over time. The stigma around mental health can also prevent people from seeking help or admitting their struggles. In many cultures, admitting you have a mental health problem can be seen as a weakness. This makes many people feel ashamed and afraid to share their experiences. The fear of being judged, discriminated against, or socially isolated can create a barrier to self-disclosure and seeking support. We might worry that if others know about our condition, they'll see us differently or even avoid us. This increases loneliness and feelings of isolation. Also, some mental health conditions have symptoms that overlap with physical health problems, making it hard to tell them apart. For example, someone might have headaches, fatigue, or trouble sleeping and think it's a physical issue, when it could actually be a sign of a mental health problem. For example, Anxiety can show up with physical symptoms like a racing heart, shortness of breath, or dizziness, which can be mistaken for heart problems. This can lead people to seek help from physical health professionals without realizing the real cause might be mental. It's important to remember that self-diagnosis can't replace a professional evaluation. Even if we recognize some symptoms and feel we can handle them ourselves, talking to a healthcare professional is essential. They can give us accurate assessments and the right treatments. If you're experiencing persistent or worrying symptoms, it's crucial to consult a qualified healthcare professional for proper diagnosis and treatment. Don't hesitate to seek help, as your mental health is just as important as your physical health. Remember, recognizing and accepting your condition is the first step towards getting the support and treatment you need. And finally, have a great and happy day. Stay positive and make changes every day. Life always favors those who try. But don't forget to like and subscribe to my channel for more helpful information. I'm Dr. AI. Facts so tight, always right.